And I see that we have more people in the room, so going to go ahead and get started. So welcome to our final session. Today really is just kind of recapping what we talked about. We're going to have a case study, so I want all of you to talk to each other as well. And we're going to have a few questions. And I also want to leave the room open for if anybody has any questions for me or for any of us here at ACU and the Star Center, we'd be more than happy to answer that for you. So just like with any of our other sessions, this one's also being recorded. Now for the recording, just so everyone knows, when you're in the breakout rooms, that part is not going to be in the recording. So it's just going to be the main session. Really excited to have you here for our final session. Use the chat, unmute yourself. We want to really make it interactive. Mariah's here to help. I'm also made as the co-host, so if we have any technical issues, I will be here to assist. And then at the end, we're going to have the normal evaluation that pops up about the session, but we're also going to put in the chat a post learning collaborative assessment. And that's specific. If all of you remember when you first started, there were 3 questions we had you answer. It's going to be the same thing just to see how your knowledge change took place. And then I'll talk about it in a moment, also regarding a follow-up that we will be doing. So actually, I'm going to skip through this for a second and go to the follow-up because I do want to mention this, so I'm kind of redoing the slides a little bit. So for any learning collaborative, we do a follow-up and we will check in with all of you around 3 to 6 months after this. We just want to see what your implementation progress is like, if we can offer any other technical assistance. And the reason that post-assessment is also important because it'll really help with that follow-up. And we're going to ask you on there, what is your preference for how we can communicate with you? We know things are so busy, and I'm sure in 3 to 6 months, it's still going to be that case. So, we just want to make sure that we're communicating with you in the most effective manner. Okay, so now let's go back to this. And I'm going to stop sharing for a moment. We're going to go and we're going to use a program called Mentimeter. So you can use this code, so go to menti.com, the code that's written on this slide. You can also use the QR code, so just put your phone up to it. I'm going to stop sharing this in a moment, go to the Mentimeter page, and you'll see the code on there as well. And we really just want you to answer, what is one key takeaway that you're going to be using after you complete this learning collaborative? And I see there's also something in, oh, thank you, Mariah. Mariah also put the code in the chat. Give me 1 second. Sorry, I'm trying to, there we go. Okay, so, and I know there's not too many of us here today, but I will wait for everyone to get a chance to respond. So I see that we have one. The first one is recruitment sources. Great. Yep, to use specific language that shows behavioral health staff. We understand their needs and positions. Absolutely. Places to post. Wonderful. And another thing with all of this, so just because the learning collaborative is ending, we're still here to offer technical assistance for everything that you need. So I have written back to everyone who submitted their job descriptions for feedback. If you haven't gotten a response from me, just let me know. I may not have received it in my inbox, so I can check to make sure it didn't go to spam, but everyone should have gotten their response by now. And if you still want to submit that, you can do that at the same time. Just whatever technical assistance you may need, we're here for you. So use specific wording and job announcements. Yep, that fit the expectation of the candidates. This is really, really important. So I like how, and then reworking job descriptions, job posting, support a work-life balance. Shared experiences and new ideas around how to present behavioral health work in a more applicant-friendly way. Absolutely. And one thing that I really like everyone's talking about here is the language and how to reach out to behavioral health staff. And it's so important to really be very specific about those expectations. And I think a big part of it is all behavioral health providers, clinicians, however you're referring to them, they really have different trainings. A social worker is going to be trained very differently than a counselor, than a marriage family therapist, than a psychiatrist, than a psychologist, and so forth. So the more specific that you can write in there on what you're looking for, what training modalities does your health center use? Is it long-term? Is it short-term? Whatever it may be really helps people know, am I the right person for this job? We'll share a recruitment plan document with new HR director. Great. And one of the other things too that I will post on the discussion board is our full R&R template. So it can be modified for behavioral health providers. It's much more general right now, but it's something that could help you as well if you want to share that with HR or leadership. Okay. So the second question is, what is one change you hope takes place at your health center to help improve your recruitment efforts? And the reason that first of all, this is all anonymous, so I don't know who's typing in what, and it doesn't come up in any way, so I did want to say that. But also, I want you to think about this, because as you go back, you start talking about what you learned here, how you can implement these things. I think it's really important in your role to also serve as an advocate for these changes. And I know that that can be very complex in doing that, but it's important to think about, like, where are we going to be advocating and putting our efforts? So more flexibility, yep, absolutely. And again, when we talk about flexibility, so work-life balance, remote work, whatever it may be, everyone may have a very different opinion on this, but the reality is, regardless of that opinion, things are changing and they change. So if you want to keep people, you want to recruit people, that needs to be there, because it is an expectation that people have. So that, yep, we're attractive to candidates. And I think that definitely can be there. It's just, taking those steps and being really agile with everything. More funding and priority around behavioral health on equal level as a primary care provider. Absolutely. And, one thing, especially when you're talking to leadership, when you're talking about behavioral health, we need to look at it as the physical is not separate from the mental. Both of them play a role together. People who have mental health diagnoses many times suffer from more healthcare ailments. So things such as, abdominal pain, abdominal issues, asthma, diabetes, especially those who have a history of trauma. So if you're not looking at it from that entire holistic way, you're really missing out on core things that your patients need. So that's also a really important thing to talk to leadership about, is that these things are not separate, especially working with underserved populations and populations who've historically been marginalized, most likely have experienced historical trauma and are facing a really complex mental and physical component to their health. So it has to be a priority, and the people you bring in really need to showcase that. So more leadership, but in on diversity, equity, and inclusion. Yep, more support for internal training for hard to recruit positions. Absolutely. Yeah, internal training is key. And if you're looking for a position that has a lot of roles to it, posting that, you're also going to provide the training that people need to excel in that. Really important. Diversity, equity, and inclusion. Your workforce should, as best as possible, reflect your population. And that's something, when you talk to leadership about this, that's fundamental to what health centers are and what they were created for. So, bring up your mission, bring up who you work with, as best as possible, challenge that, obviously in a respectful manner, but create a dialogue. Leadership commitment to supporting flexible schedules. Yep. And one thing I would also say, just with all these, and then the last one, use current staff members' experience, yes, to attract candidates. One of the things I would say with this is, at the end of the day, if you're not making those changes to the flexible scheduling, to, better retention tools, whatever it may be, it's going to cost you a lot more money to lose people than it is to keep them there. And it's just going to keep shifting more and more towards these expectations. And I think people through this great resignation have really made that clear, that that's what they want. And then, yeah, use your staff members. They are the best resource for bringing in candidates, especially mental health. I don't know what it is. It's like we're sort of this group that sticks together really strongly. And I know when I started working at a place where I was employed previous, I had told someone who was also in mental health where I was, and the first thing they were like, oh, I've heard this, and that. Here's a place to go work instead. Just mental health clinicians, providers, people in this field really want to like look out for each other as to what is and isn't a good organization to work for. So thank you so much, everyone, for answering this. Just really appreciated. And then let me go back to the slides so we can also get into our case study. Okay, so just a general overview. As we said, you cannot do recruitment without retention. So you need to have like your house in place. We also know that when you don't have staff, when you're struggling to find staff, you could put in the best programs, but if you don't have people there to use them, then that's also a problem. So that's why these two are tied so clearly together. And everything that's in your retention plan, from the focus on the mission, equitable compensation and benefits, flexible work schedules, making sure people have career paths, all of that are things that you're going to be using as part of your recruitment efforts when you're posting for jobs, when you're interviewing candidates, all of those things. And keep in mind too, behavioral health or mental health providers, we're very specifically trained on interviewing, talking, asking questions, reading body language. I mean, this is what we do. So when you're talking to someone, when you're trying to recruit someone in the mental health field, when you're using the language in your job postings, the questions that you're asking them, they're analyzing you just as much as you're analyzing them, and probably even more so. They're being very careful to see, is this the place where I want to work? Do they understand what I do? You know, do they get what I studied? And I see there's something in the chat, so I just want to oh, yes. So Betsy was asking, no worries, Betsy. Yes, so I sent back the feedback today on the job postings. So Betsy, I did send it to you as well, but it was like right before this session started. So you may not have seen it yet, but it will be in your inbox. And I was just saying, if anybody at any point has any other questions, wants to share their job announcements or any other questions related to this, please feel free to share again, and I'm more than happy to provide that technical assistance. Okay, so as I was saying, very important to look at all these things because these candidates are in general looking for that, but at the same time, they're really analyzing all of these different very specific details, simply because that's what we're trained to do. So when it came to retention, we went through, and I know it was a lot of content, but we went through this step ladder of, when it came to recruitment, we went through this step ladder. And again, all of it is tied in retention and recruitment. But we really, what I kind of wanted to wrap up and point out here is that you really need to have each step in place to move on to the next one. That's really important. But because you're looking specifically for mental health providers, to expand your behavioral health teams, the need that there is right now in the community for this, you have to have really the right foundation in place. So it's having the behavioral health director on the recruitment team, having a provider who is doing this work day in and day out, because the directors, oftentimes don't do the clinical work. So you want to have that. What priorities are you looking at when it comes to specifically your behavioral health teams? And I'm sorry, oh yeah, Kevin, no problem. putting a budget that is feasible, but also that it's going to get you who you need. So at the end of the day, I'm just going to keep saying it. If you have people that leave, it's going to cost you a lot more. And another way to also speak about this to leadership is that this is a necessity, a real necessity in the community. And as a world, we've all collectively experienced trauma through COVID and had already experienced enough trauma from before that. People are in great need of behavioral health, mental health, and health centers are a key place to offer that for many people that don't have anywhere else to go. So again, it's part of their primary care, it's part of their wellness, it's part of their overall health. And health centers are all about prevention, of working in the community and making sure you have the right workforce in place, making sure that you are funding it properly. It's that same prevention of basically so that people don't leave and you're left with not enough people to really work with your population. Your advertising and social media, go to places where the type of people that you are looking for are going to be. So Idealist, a really big one. I mentioned that a lot. Utilizing, LinkedIn, looking at just basically anywhere that you are searching for mission-driven individuals. So, minority-focused organizations, the local schools, and not just local schools. A lot of mental health degrees are also offered online, and more programs are doing that. So they're, huge schools that have national reach and want partnerships with your organization. So look at that, see who has these online programs that may need field placements, that may want to post jobs, whatever it is. Your interviews, again, I want to go back to saying, the person who's coming in, especially in mental health, is going to be interviewing you just as much as you're interviewing them. Your body language, the questions you ask, all of those things are going to be fundamental for them. And it's going to be really important in those interviews that you talk about what are the modalities that this person is going to use. So do you want someone with, short-term therapy? Do you want, longer term? Does your health center, really support that? So like psychotalk therapy or cognitive behavioral therapy. And I know these are very specific things to discuss and question about. And that's why having people from the behavioral health team as part of the recruitment team is so important. Asking the right questions when it comes to diversity, equity, and inclusion, and talking about it from the perspective of how you work with these populations. One thing that was a lesson learned for me personally when interviewing individuals, we normally would ask a more personal, what does DI mean to you? And in realizing that that can be triggering for some people. So it's really looking at, how do you work with these populations? What background you have. A lot of the training is also very specific to certain populations. My social work training was specific to working with veterans. So, just asking the right questions. Contracting, I know that we had this conversation, especially for social workers, but I would probably say more mental health clinicians as well. People want to be able to do their own independent practice for many different reasons. One being the financial aspect. Going to these schools, having these student loans is very expensive for usually jobs that are not really covering what you have to pay back. So having a private practice allows you to sort of meet those needs. But at the same time, people who need hours, a certain amount of hours to stay licensed, private practice allows them to do that. So those type of things. So looking at what are the clauses in your contract if you're going to be using them with your providers. And then finally, onboarding. And the onboarding should be the same process as it is for the primary care team or for really anyone else that is coming into the health center. You want to integrate them into the health center, and you want to let them know that behavioral health is respected. It's something that you know the importance of it, and think about them for the future. Think about them for leadership positions. Get creative. with what you're offering someone as you onboard them. So I'm just going to stop there before we go into our case study. And I wanted to ask to see if anybody had any questions about all this. I know that that was a pretty fast overview, but I wanted to leave time for each of you to share with each other. And I'm not seeing any questions. You can feel free to unmute yourself, or any questions from the homework. Okay, I'm just going to give it one more moment, and then we'll get set up to go into the breakout rooms. Okay, so I think we're good with questions. Let me stop sharing. So Mariah is going to put in the chat the case study you'll be working on. So what I'm going to ask is go into your breakout room and spend about maybe like 5 minutes reading through the case study. So we used this case study in our previous recruitment boot camp. If you have seen this before, I want you to look at it from the perspective of how much things have changed even in that small amount of time. At the bottom, there's going to be questions that you will answer. Discuss that with your group, and then select one person who is going to come back and basically talk about the responses to the questions, what all of you discussed, and we'll go through that group by group. So Mariah has put the case study into the chat, so everyone make sure you click that link, and then Mariah, whenever you're ready, you can send off everyone into their breakout rooms. Okay, so welcome back, everyone. I think everyone is back. So what I wanted to do is basically just go over what you discussed. You don't have to go through each of the questions or anything like that, but it's more just a dialogue of what we've talked about throughout this learning collaborative and see how you're able to apply that. So that really was the purpose behind the case study. So who is going to be talking from group one? And I just realized, Brian, do we know who was in which group? Because I know it showed up. I believe group one might have been Kevin, Chantel, and Lydia.
I think Alicia. I think Kevin, Chantel, and Alicia.
Oh, sorry, and Alicia. Yeah.
Alicia. So, sorry. Okay, names. So yeah. Oh
no, I may have pronounced it wrong as well. So. Okay. Yeah.
It's either or.
It's either or. Great. We really kind of discussed a couple of things. One, we were able to share kind of what was unique to our recruiting process and how we would implement that in this situation. We heard Chantel is able to offer a somewhat of like a reimbursement or payment to any staff who is able to recommend an individual who ends up becoming an employee. So that was something that kind of led us to the conversation of, we want to really try to include everybody within our clinic in the recruitment process and get their input, and both from a applicant pool process, and also from what do you believe this position entails, and what skill set and education and training should the individual have that we're looking for, because as a clinical supervisor, I might have an idea of what the behavioral health provider should kind of have, but I'm not the only person that interacts with that or sees that person. So it's helpful to have those different lenses. In terms of kind of where we would look, it varied, but we, Alicia really kind of had some really great ideas in terms of kind of putting her feet to the pavement and just going to social work Facebook sites and groups, going out into the community in that offer services or that are open to individuals that access those services, and asking for cards and looking for people to reach out to. And then we also just kind of talked about how it's just really important to try to network and reach out to individuals that you've worked with in the past, and ask them if they have anybody that may be interested and if they could reach out to them. It's much easier to be open to a job that's sent to someone from someone you trust, and Indeed or an email. And then in terms of let me check the questions one more time. Hold on.
Take your time.
That's okay. Okay, so what things would you consider before posting the job? We talked about just the patient demographic. We would want to know kind of the race and ethnicity of the patients that we serve, as well as, what are their needs and what commonly comes up in terms of their needs. So we can make sure that, we're looking for an individual that has that training experience. And again, trying to find an individual, if at all possible, while using fair hiring practices looking for someone that looks like the patients that we serve. And then also Chantel had a great idea of interviewing someone that has gone through our services, their services, and seeing what they wanted from an individual, and what they received and what they felt was missing. I think would be a really good start. And then we talked about what websites we use. What would you need to find out from the potential candidate? I think kind of beyond, the normal stuff, the resume, the training, the education, the licensure, we really want to know, why this candidate likes and is passionate about the population they work with. Working with individuals that are houseless or homeless can be really difficult, and takes a lot of hope, takes a lot of work. And if you don't enjoy that work, then you can, really become quite negative, both with the patients and with the individuals you work with. And for whatever reason in behavioral health, that's allowed, to complain like, oh, can you believe this? Or another time I've had to deal with a patient who hasn't shown up or a client who hasn't shown up. And a lot of times individuals will kind of commiserate and like find, I guess, value in talking about how difficult their job is. And we don't really want that. And so really looking into how they approach their job, and then communicating the mission, vision, and values, aside from the mission statement. We would really like to, any individual that's on the panel, kind of prep them before the panel interview and ask them, what the what the entity's vision and values are. And so they have an ability to kind of share, the stock statement of the vision, mission, and values, but also kind of how they see the clinic's mission and values are and how it applies to the work that they do. And that would probably give a more diverse and detailed idea of to the candidate in terms of why the individuals work here and what the individuals see the agency does beyond just the mission statement of values. And then Chantel also indicated that she felt it was really important to, communicate that even within the job posting, and to make sure that the individual that's applying kind of has a full understanding of not only what job they're applying for, but kind of what community they're applying for. And then how would you communicate the benefits you offer? Alicia noted they don't really communicate in the posting, and Chantel noted they did. Minor public knowledge because I'm a county entity, but we also thought about, since some benefits are flexible, obviously beside the, payment, the reimbursement, the salary and the insurance coverage. So, really asking the candidate, what would make this job more desirable from a benefit standpoint. And even if they do not apply or end up taking the job, then we would at least have that information for the future, such as like, hey, can we offer 50% telework? Can we, increase the vacation days that we provide? So that was kind of it. Did I miss anything, Chantel or Alicia?
Awesome. Thank you for that. That was super detailed. Chantel, I really love the idea of you guys offering, essentially an incentive for people, bringing people in. So Kevin, thank you for going through that, through everything. There was another thing that I wanted to mention, and this came up recently because outside of ACU, the volunteer work that I do, I serve on a lot of boards and committees with different behavioral health organizations. And I was talking to someone who serves on one of the boards that I do, and apparently they've had people reach out to them because they wanted these organizations to do job postings and reach out to their members. And that was actually a great way to sort of like get in and then be able to talk to the executive director, things like that. So I just wanted to mention that because I think that that's also a good way if you're looking like National Association of Social Workers and many other places. So thank you so much, group one. So group two, so I believe it's Betsy, Lydia, you were in group two, and then Deborah. So whoever wants to present.
We didn't talk about that. I think Deborah probably sounded like she was taking notes, but do you mind, Deborah?
Yeah, I can go ahead. A lot of the same overlapping things, but a few additional thoughts. So as far as the team, we talked about including the current therapist and or psychiatrist, at least get their input, if not including them in the screening and interview processes. I mentioned that we include our medical director or CMO, no matter what discipline we're hiring. And then Lydia mentioned that they include IT as well. So we had talked about those kind of things. As far as things that we need to know, we talked about finding out, is a therapist the right position that we need, and what type of credential are we looking for in order to know which places to post. Also, kind of if we could get the long-term vision, because it says we've got grant funding to grow the department, but right now we're only looking for one. But what are we looking for in the future? We may need to hire someone that's a leadership type that will also help grow that department if the current psychiatrists or therapists aren't that type. So we need to know the long-term vision. And then we also need to know the budget. It mentions grant funding, so we don't know how much that might play into being able to advertise for the positions, or if it's only for salaries, or what it's designated for. As far as posting, we talked about all the different places we've already talked about, as far as Indeed and school boards. And I mentioned that if this community health center is qualified for National Health Service Corps, that they should post on Health Workforce Connector and mention the loan repayment possibility and the benefits. And we talked about, depending on which credentials we're looking for, targeting those boards for those credentials. And Lydia mentioned that for Indeed, they didn't have a lot of success with just the plain regular listings, that they really had to invest in a budget to get those highlighted listings in order to get that response. And of course, we mentioned idealist because we've heard that a lot. And then as far as what we need to know from the candidate, we thought we wanted to talk about the population that they're working with. It looks like while the center is open to all, that they focus on homeless and public housing, and that's kind of a specific group of clients that we want to see if they have any experience with that group, and if they're comfortable in a diverse environment. And then as far as how we would communicate the mission, vision, values, and benefits, we talked about starting out with the ads and postings with some sort of level. And then as you go through the interviews, the questions that you ask convey what your priorities are and what your values are to the candidate. So that the questions, to think about what you're asking. And then also to reinforce throughout the process what the benefits are. And what we do is use like an increasing level of detail. So the ad has a very, it just says like medical, dental, vision, possible loan repayment, those kind of words. But then I have a PDF that I have pre-made each benefit year that goes through some of the additional things we have for providers, like the continuing education, things we have like PTO. So it says how much PTO, how many holidays, that kind of thing. And then I have, that one's just 2 pages. And then I have a longer one that's got more pages that I send further in the process if we're getting to that point, that actually tells them the cost and how much are their premiums going to be and things like that, so they can really compare it. How much are they going to make versus how much is coming out for benefits. So just kind of throughout the process, making sure that they understand at different points about about those kind of things. So that's
Wonderful.
Did I leave out any major points?
Great. Thank you so much. All of you are so just specific in your responses. So I see that we're almost out of time. I did want to give Rhonda and Kristen a chance if there was anything they wanted to share. But as we do that, as I said, Mariah put the post-assessment link in the chat. She's also going to have the evaluation pop up. So I know it's a little bit of multitasking, but we really would appreciate if you could fill all that out. And then Rhonda and Kristen, is there anything else you would like to add to the conversation we had today?
No, the only thing I would add, I'll add one thing and I'll let Kristen add one thing. We talked about the importance of interview shadowing. Nobody likes to be surprised as an employer or as a candidate. And so we often, particularly when we bring people from out of town, we pretty much dedicate a day. And a big portion of that day is to have them shadow whether it's a therapist or a primary care provider, so that they can see what the job is like. In a community health center, these positions are typically more fast paced than if they come from a community mental health or a private practice. The population is very different, and so we like them to be well prepared to know what the setting is like, and we like to know how they react to it. So Kristen, what would you pick?
I mean, everyone covered a lot of things, so I feel like we captured it all, but I would just piggyback that, and we just talked a little bit about making sure the right players are in the interview process and what a first interview looks like and really what a second interview looks like.